have you guys join us today for our Friday webinar series. This week, we're talking about COVID and flu vaccines, which we hope that you are getting both. And if you have an opportunity to get a booster as well, especially as you're going, hopefully you're going to get the opportunity to see your family this year. And we want to make sure that you protect everybody and make sure that certain that they are stay safe. Just one quick announcement that I have. We every year, and I think you two may qualify for it, is we have a top 40 under 40 leaders in public health that we have every year. And we're going to go ahead and put that application out there on our website now. So you can go ahead, you two should go ahead and apply. And we'd love to see you in the 2022 class. And with that, I'm gonna go ahead and send it over to the person that knows all things flu vaccine, Dr. Laura Lee Hall.
Thank you, Brandon, so much. I'm going to share my screen and kind of orient us to today's session. Let me do that. So, welcome again, everyone. It's really a pleasure to be here this Friday before Thanksgiving. I know everyone's busy with the flu season and also the holidays coming up. We wanted to focus on some of the regions that were doing efforts to support leaders in protecting people of color from flu and COVID through vaccination, and have a punny little title, Houston, we have liftoff. And it really, it stems from our belief, our fast held belief, that community-based health promotion is critical. It is the key, especially in communities of color who've been underserved. So we want to provide as much support and resources for those leaders in the community to own and sustain improved health. I want to thank our faculty who are here today, our supporters of our flu and COVID vaccine efforts, including the CDC and Sanofi Pasteur. And I really want to thank all of you for your ongoing championship of flu and COVID vaccination. A little housekeeping. Enter your questions in the Q&A box, please. And there will be a recording of this session available next week. So we have several people invited from the city of Houston here. Dr. Cherice Conley-Harvey, and you see she is the Associate Medical Director of Care Coordination and QI at Kelsey-Seybold Clinic, a major health organization in Houston. We also have the Director of Quality Improvement at Kelsey-Seybold Clinic, Leon Jerrels, who is a force of nature, both in his clinic and in national programs. We are looking forward to the pastor of Brentwood Baptist Church in Houston joining us, Dr. Joseph Ratliff, as well as the amazing Louis Good, who's the owner of the Good Looks Barbershop. So we're hoping they're going to be able to join us as well. And these are the questions I've basically poised or put forward to each of our participants, asking them to really share what their role is and what they've been doing, what challenges they've faced, and their plans moving forward. I think all of us can learn something from Houston. But let me remind everybody first why we're doing this. If you look at the data from the CDC available yesterday, but it's for the week ending last on the 5th, our blue line here shows vaccination rates in essence, and they are much less than last year. So that's the message here in the slide. Our flu vaccine rates are lower this year. In children, 6 percentage points lower for all children as of November 6th compared to last year, same time. So only 34% of children this year have received a flu shot versus 40% last year. For Black children, it's 10 percentage points lower. So only 25% of Black children in America have received a flu shot this year compared to last year. That's a pretty low number. Similarly, we see that among pregnant persons, there's much lower flu vaccination going on this year through the end of October, 17% points lower. And for the Black pregnant women, it's 20% lower. Only 21.5% of Black women who are pregnant have received the flu shot as of the end of October. Again, quite a low number. Now, this was shared with us from some industry sources at Sanofi, and they're looking at flu vaccine uptake in this red line. And you see that it was slower to begin, maybe not a bad thing, but seems to maybe have peaked and is going down much lower than the last couple of years. So this is of concern if you are afraid of a flu outbreak and a pandemic overlay. This slide is a little bit busy, but if you just look, so this is this year, last year, the year before, rates are down in the pharmacy and in the medical office. This says the same thing. Rates are down in both the pharmacy and rates of vaccination, I should say, and the medical office. And this is as we are maybe seeing the beginning of a significant uptick in flu. So the most recent report from CDC shows that while overall the rates of flu are relatively low nationally, there's been an increase of flu A, H3N2 detected in recent weeks, especially among young adults and children. I mean, they're the ones going out to school, right, in college. And they are often the drivers of community spread of flu. And there's been report of outbreaks among young adults in colleges and universities in several states. So I just did some Google clipping. You see Boston reporting flu cases are up 23%. There's been a lot of attention to the major outbreak, it seems, at the University of Michigan, 528 cases. In Florida, there's been note of uptick in the amount of flu breaking out at several college campuses. And so I guess the message is it's not too late to get a flu shot. Flu season usually peaks in February, and the holiday seasons certainly present increased risk of exposure. And COVID is increasing in many places. So we really are seeing some trends that may be worrisome and make getting a flu shot really important. So I'm going to go back to our panelists now and I'm going to put this up here for their purposes. Stop sharing. And let me turn it over to you, Dr. Conley-Harvey, first, if you would talk to us about your experiences, who you are, what you've been doing, what you worry about, and what you think moving forward should happen.
Okay, thank you, Dr. Hall. So my name is Dr. Cherice Conley-Harvey. I've been practicing at Kelsey-Seybold Clinic for the past 21 years, and I'm in our Pearland location, which is just south of Houston. And I see patients Monday through Friday here, and pretty much every visit, especially during the flu season, every visit I address whether patients are vaccinated against the flu. And of course, since the pandemic, also the COVID vaccine. And I have found that basically you just have to meet the patient where they are, where they are mentally and from an educational standpoint. And especially in our community, we already have a lot of bias towards vaccines and a lot of hesitancy that is just in our community that I find on a day-to-day that I have to basically debunk the myths that are associated with that. I also discuss a lot of my personal experiences on the front lines when I'm taking care of patients in the hospital and how patients who are vaccinated compare to patients who are not vaccinated. And sometimes people see things in the news, but sometimes when you talk to them on a personal level about what you experience, they become a little bit more open to getting vaccinated, and maybe about what they've read, maybe like, she's really experienced it. So I try to do that from a personal standpoint. From a clinic standpoint, also in pretty much all of our clinics, which are around the whole metropolitan Houston area, that we always offer the vaccines to our patients even before the doctor even walks into the room, so that if they consent to it, great, we can start prepping that vaccine, they can get their shot, be on their way. But if not, that gives me that opportunity to go ahead and to discuss it. We have immunization nurses in most of our clinics where we have dedicated schedules for the flu. We have dedicated schedules for COVID vaccine. So if you don't need to see the doctor, you don't want to see the doctor, you can go ahead and come in and get your vaccine. Also, for those who don't even come in, community-wide, from a telemedicine standpoint, we send out messages to our patients on our patient portal, which is our My Kelsey Online, and put it on their to-do list to, hey, come on in. So if they haven't been, encountered anybody in the clinic, that still we're reaching out to the community to try to get our patients. As far as challenges I've experienced, the biggest challenges are, like I mentioned, the hesitancy that's in our community baseline, but then also the person who feels that, oh, I get the flu every time I take the flu vaccine, which that's not the case. And so that's one of those myths that I try to debunk, that you're not getting the flu. It's just a reaction, that your immune response to that vaccine. Actually, since the COVID vaccine has come out, I found that people are starting to understand that more, because I don't know about you guys, but once I got my dose of the COVID vaccine, I did have a reaction, and I was pleased to have that reaction. So I was like, I know my immune system's working. And so now that people were aware of that with the COVID vaccine, it's kind of like when you explain that with the flu vaccine, they're even starting to get it more. So I do have some patients who have declined the flu vaccine in the past, who have been more open to it. And then also understanding that how the COVID vaccine has been affecting the pandemic, that how important the flu vaccine is also. So it seems like it's been a good opportunity. And basically moving forward, I just continue to do more of the same, just educating people and trying to debunk the myths and get people from thinking that everything they read on social media is correct and believe in the science. Thank you.
That's wonderful. So you're one of those great doctors everybody needs to have, because
you.
you're, willing to address the myths that are out there, the fears that people have. Before I turn it over to Leon, I wonder if you get asked a lot about whether if I get a flu shot or if I get the COVID vaccine, does it protect me against both? Have you been getting that question?
I haven't. No, I think at least the population I've been seeing, they pretty much know that it's two different things. What I have experienced a lot of is the fact that we haven't been seeing any flu this year, and we essentially had no flu season last year. A lot of people are like, I really don't want to get the flu vaccine. Why do I need to get it this year? We haven't seen any flu. And I just let them know that's really a false sense of security, because we've had some serious flu seasons. And as things open back up and people are masking less and social distancing less, yes, those people may be getting their COVID vaccines, but that's just ample opportunity for the flu to really increase. So that's what I've been seeing more of.
Oh, thank you for that. So we've just heard from a physician, a frontline person that interfaces with patients. Let's hear from someone who has to think about tens of thousands of lives that are under his purview, and how he would characterize what he does and is doing, and what barriers he faces, and what we should be doing moving forward. Leon, I turn it over to you.
Thank you, ma'am. So my name is Leon Jerrels. I'm the Director of Quality at Kelsey-Seybold Clinic. I've been here going on 14 years. I like to consider myself the chief negotiator of the organization. because I have to negotiate between the physicians, the administration, the patients, and the insurance companies just to develop different initiatives to make the patients' lives better and make sure that we provide the best quality of care that we can. I have purview over the overall clinical quality of care at Kelsey-Seybold, as well as the patient experience. I think one of the biggest things that I do is I assess the population as a whole. I look for different variances within that population to develop different initiatives to make sure that those variances are corrected. In regards to flu and COVID, I did a community assessment last year just to find out what individuals were thinking about the flu shot. And I was just so surprised that there was, I would say, about 50%, 56% of the African Americans and Hispanic individuals still felt that getting the flu shot would give you the flu. And that's sad. You automatically know that there is a barrier there if they're still thinking that with all the information that's provided out there, those misinformations and mistrusts of the flu shot are still out there. And that, to me, that is one of the hugest barriers that is very hard to combat, because these individuals are getting that information from their family members and their friends. And, the physician, which is probably one of the most powerful tools we have in healthcare, their advice usually has the power to sway individuals. But when you got that mindset that, oh, no, the flu shot is horrible, I mean, even the physicians' advice kind of takes all that away. So I would say one of the other things that we do in my department is we work with the providers and the clinics to come up with different initiatives that are tailored to their particular locations and their populations that they serve. We are opening several clinics that are in underserved areas in the last year or so, that they have opportunities there to focus on those particular populations, and then we could work with them to develop specialized initiatives. We do our ongoing initiatives for the clinic anyway, so as a population as a whole, we kind of tackle the whole population by doing outreach, like Dr. Conley-Harvey mentioned. In the past and this year, I do mass flu outreach to everybody, but I also do 2 additional outreaches to the Hispanic and the African American community, because I'm an African American man, and I know that sometimes it requires a few extra messages for me to understand that I need to go do this. So in the past, I've done this, and we saw a almost 10% increase in the flu rates for the African American and Hispanic community just by offering them 2 additional reminder messages. And this year we're going to do the same thing, but we're going to kind of address misinformation in these messages as well. So we'll do 2 additional messages with a little bit of additional added information to address those misinformations that the patients they're hearing on a daily basis, and try to give them a little bit more information to let them know that it is safe to get a flu shot.
So what do you think is the most challenging thing in your role? And other than the some misbeliefs or false beliefs about flu vaccines?
I guess the most challenging thing in my role is trying to find the proper methods to reach the patients. Every patient doesn't, even though we have one of the highest rates of usage in our patient portal, individuals may not look at the portal. They get a lot of messages on an everyday basis. Reaching out to them that way from the portal, you may have to send out actual snail mail to reach those patients, or set something up in the clinic. So trying to find the best way to outreach to those patients that they're going to actually pay attention to, and making sure that you're tailoring that outreach to the whatever patient population that you're looking to re-energize is also important as well. So we have a large patient population. We see over 1.5 million visits a year. That's a lot of people, and there's a lot of time it takes to kind of develop all those individual programs to meet those needs. I mean, on a daily basis, we have the flu to deal with in the flu season. We have COVID now to deal with. We still have hypertension, diabetes, hypercholesterol. We have to deal with all those too. So we have to allocate our time to be able to make sure that we can touch all those different diseases, and as best as we can to make the most of the manpower and resources that we have.
So I'm going to ask both of you, do you collaborate with any community partners outside of the healthcare system to assist in getting the message out about the importance of flu vaccination and COVID vaccination and how to do so?
I'll let you go, Dr.
I'm-
Conley-Harvey.
Actually, I'm not sure. I know we have a lot of community outreaches, and I believe we do, but I don't know the specifics on that.
Okay. So from our side over here, I would say our marketing department, along with our medical staff, are very strong when it comes to that community outreach. Our marketing department sets up multiple. So we're in Houston and Kelsey, we're blessed because we have a very diverse population. So our physician makeup is also as diverse. So we have a huge pool of individuals to pull in so that we can set up radio station interviews with those physicians that match the demographic for the radio stations. We can set up videos or television interviews for those individuals that match those demographics. So we do a lot of that outreach and informational. We work with the City of Houston, which is one of our largest contracts. We work with them a lot to develop different educational programs for COVID. We provide vaccines for our first responders in multiple different areas in Houston. It's an ongoing partnership. Like my department and what we do, we work with a lot of the communities as well, nationally, statewide, developing and working on different initiatives and how to address the different populations.
I will just add here, if you don't mind me jumping in, that we've worked with a number of churches around the country. One in Trinity Baptist Church in Columbia, South Carolina. Another is Liberty Grace Church in Baltimore. And they have both done activities in collaboration with health systems and health departments to have town halls, quote unquote, Zoom meetings with their parishioners, their congregants, to, kind of take the temperature, if you will, of their perspective about COVID and flu vaccines, and also to have experts there to answer questions that they may have. And so they did these activities, but they took it up a level. They would partner with a group like yours and have vaccines delivered at their church sites. And they took it to the media. And they were a trusted voice. I know that physicians are a very important trusted voice for people in terms of a flu recommendation. But certainly in the Black community, the ministers are also another trusted voice. They were able to achieve 15% population health increase in flu vaccines in the last year.
That's good. Yeah.
I mean, so that's a pretty, and these were in hard hit areas, poor, underserved communities. So, but that partnership with healthcare, I think, was really, really unique in it, and just wanted to call it out. So before I begin asking you questions that are posed by the people who are attending, Leon, how do you create more Dr. Conley-Harveys? Who is passionate and does this? I mean, because I work with thousands of doctors who all know vaccines are important and want to do a good job, but prioritizing it, being passionate about it is not a super common kind of aspect. So how do you do it?
I think one of the easiest things to do is make sure that you get physicians involved with the initiatives that you're doing. We try to make sure that we have a physician champion that's spearheading almost all of our initiatives, because physicians tend to like to listen to physicians themselves more, so that when you have a physician that's spearheading that's that voice to the provider. And that helps us kind of spearhead all of our quality initiatives. It also is just including other providers. You may have your physician champion, but including other providers. Right now, we have a plethora of young providers now who are eager to be part of the organization. So reaching out to them and including them in the initiatives that you have. Just like that, we're working with you to do the effective and cultural competent recommendations for the flu. I sent that to the whole physician population. So that is it'll be an awesome talk, but it's also a good advertisement for the quality improvement department, because these are the kind of opportunities that we have out there for those new providers or young providers to grow and learn about quality improvement. So it's all that inclusion, making sure that it's visible. I make sure that whether it be Dr. Conley-Harvey or the other physicians that I work with, I make sure that we have opportunities like this, that the other physicians are aware that, this is some of the things that come with that, those quality initiatives, getting themselves out there, making sure that everybody understands that they too understand what it is to be a quality physician.
Also, you have to lead by example. That's number one. And then every workplace has their own culture. And I would say one of the cultures here at Kelsey is that we value the importance of vaccination. And so that's why clinic-wide, that's how we address vaccines, is that at the visit, even the person who rooms the patient, starts that conversation. So it's basically just a part of our culture. Yeah. And as far as for flu and COVID, we do have all our staff and physicians are required to get vaccinated as well. So it's part of our culture.
Why don't you say something about two of the points you just made? Many places are struggling with their nursing staffing. Just the trauma, I'm not even going to call it stress, but the trauma that nurses have experienced have led them to basically quit. And I'm just wondering if you've experienced similar stresses. So let me just put that out there.
I would have to say we have not had this mass exodus that some places have had. As far as, requirements for the COVID vaccine, we've already had a requirement for the flu vaccine for many years. So I don't think that it was a major issue when COVID, not that there was none, I'm not saying that, but once again, with education and basically with education, it was like, this is what we're doing and this is why we're doing it. So I feel that we had very little fallout from that. I do feel from a high level, though, that they try to show the nursing staff that we really appreciate them. We need them. They are part of the team that, so they get team awards and bonuses, basically to be like, hey, we need you and we're all in this together.
That's amazing.
Like she said, we haven't had a huge exodus, but with our own expansion, we're growing throughout the Houston area. We are finding that it is becoming more difficult to recruit new additional nursing staff because everybody is fighting over those same one or two nurses to try to look like the better peacock to get them to come to their organization. But yeah, like she said, we require both the flu and we require both the COVID vaccine. For the flu, I think we have done probably around 92 or 95% compliance with the flu annually for a while now. We even have a competition for the flu, which is called the flu bug, Cage the Flu Bug, and we pass out the trophy around the different organizations and different levels, large or small clinics. So they turned that into a competition. So maybe in the future we'll have Cage the COVID Bug. I'm not sure, but I'm sure that's down the line. That has worked greatly throughout the organization.
Well, I am going to ask you about what's different about Houston, but let me turn it over to some questions we have from the audience. One question I think is very important is, what strategies have you found work well with pregnant and breastfeeding women? That's an important population.
Pretty much the same that we do with all our patients, and basically that's education. I know in our OB-GYN department, just like in our primary care department, when that pregnant woman is coming in for their visit, it's already information given that it's an expectation that to, keep you and your baby safe, you need to get that flu vaccine and getting your COVID vaccine. And that also includes a tetanus, a Tdap vaccine. And that's very much just a part of the expectation. And so we know it in primary care, and then our OBs that take care of the pregnant women, they educate and press upon the women as well.
So it's just a matter of education.
And being a part of the culture.
Yeah.
I mean, I can imagine that many pregnant women or nursing women aren't clear that this is what is recommended, and they don't want to do anything that would harm their baby. So
right, they want to know that it's okay. And I think when you have the person that is caring for you and is seeing you through these 40 weeks, that they care, that they're going to tell you to do the right thing.
And we do I'm sorry, go ahead.
Go ahead, please. Go right
We
ahead.
do several programs like our Baby on the Way program. That's what we have all these new expected mothers. They can come in and we kind of give them an overview what to expect from Kelsey-Seybold and how we handle and manage their pregnancy. So that's a good view of what to expect. And we mentioned, these particular vaccines are recommended.
Right.
So that's another place for them to get additional education and information on those.
That's great. So another question, this is kind of a population health question about conducting community assessments of need. And they wanted to know if you have your own community assessment tool that you've developed, or is there something you would recommend so that a health system could understand and accurately kind of map out the needs of the community?
Well, I'm glad you say that, because normally we utilize the community assessment tools from the different hospitals in our area. Just yesterday, we rolled out our own that we developed ourselves. And those questions and surveys are going out today to the population today to do our own specialized Kelsey assessment of our patient population. So the hospitals have a good one, but they're normally 2 to 3 years old. And with how the population is changing, how healthcare is changing, and now we need something that's more tailored to the services and the particular needs of our own patients. So we developed our own.
That's excellent. And I presume that also gets at social determinants of health,
Yes.
Kind of the barriers that I can't get to where you're giving the shot, or I won't be able to afford it if they think there's a fee cost associated. So you're tracking that too, right?
Yes, like I said earlier, we did a COVID assessment and a flu assessment last year. We're going to do it again this year. And those were specialized specifically for COVID and the flu, just to see where our patients' perception when it comes to COVID, how we were handling COVID, how we were communicating COVID. Now this year, we're going to do one to make sure that we find out how we are handling and managing the vaccination for COVID.
So this is an interesting question from our attendees. We are blessed, quote unquote, with a multiple media approach, right, to communication, person to person, local media, social media of so many sorts, patient portals. And then we have, the dark side of all that with misinformation that's kind of coming out and maybe even targeting communities of color. The question is actually, how do you do local media outreach for people who are not, using technology as their main source of information?
In the beginning, I was almost feeling like the dark side was bigger and stronger. But I do think that over time that I'm seeing more information. I know Kelsey sends out information to employees, and then Kelsey also sends out information to our patients as far as evidence-based information. In general, basically as a practice, we practice evidence-based. And so we want our patients to have that information as well. But I also do think that in the news, not that I watch a lot of it, to be honest, but in the news, that I am starting to see more and more information that is coming from more reputable sources.
Do you have anything to add to that, Leon?
Okay. Yeah, like I mentioned earlier, we work with several of the news organizations. We always provide informational interviews with our local news. So, and they see Kelsey as a information source when it comes to different healthcare issues such as COVID. I know Dr. Mazoon has been on several different news programs speaking about COVID and trying to clear up some of that misinformation there itself. I know that our Dr. Jordan worked with the Houston, work with what I want to say the mayor's office to develop some informational messages for the African American and the Hispanic community. You know, the power of, you know, they look just like me makes an individual want to listen to that individual. So, I mean, it is a community effort. We see ourselves as a member of the community, and we are, you know, as a service organization to the community. So we try our best to provide information and act as a knowledge source for the community.
We also even still put small articles in the newspaper, the Houston Chronicle and the Defender, which whenever they pop up and want something from me on that, it always surprises me because I'm like, oh, people still read paper.
Right.
So yeah, so even for those who aren't using any electronic devices, we still put the information out in the papers as well.
That's so excellent. Okay, I'm going to ask you this question from one of our attendees, because I think this is just perennial. If the flu shot doesn't give you the flu, why do people report flu-like symptoms after taking the flu vaccine? And what's in it that make people feel this? How can we educate about ingredients? This is just a persistent question, so I really wanted to put it forward.
So, I mean, it's basically your body mounting the immune response. So, you know, whether it be to the COVID vaccine or whether it be to the flu vaccine, or whether it be you're actually encountering the flu or a cold, your body is going to have a reaction to it. And so when you have that reaction, then hopefully your body then is going to remember when it sees the flu that, okay, we've seen this before. We had that reaction. We know how to handle this, and we're not going to get the flu.
So I see this as a double-edged sword, because if you tell individuals that this may give you flu-like symptoms, that in itself may be a push that individual away.
Right.
Like, so, but it also, if you don't tell them when they get the flu-like symptoms, they're gonna be like, well, this gave me the flu. They didn't tell me this was gonna give me the flu. So it's a positive and negative in itself. But you know, those flu-like symptoms that you do get, it, like you said, it's just the reaction of your body and to create those antibodies.
And I lean more towards telling the patient, and especially once I had the COVID vaccine myself and experienced the reaction, then you can really explain to people what is happening, but then still explain why you need to go through that. And it's okay to go through that, you know? And so the people who didn't already know that was going to happen, we got a lot of phone calls and we get a lot of messages like, hey, I just got this vaccine and now I have a fever, or now I have body aches, or I have, you know, this problem. And whereas all the patients, it's kind of other patients who had the information, they're kind of like, oh yeah, you said I was going to feel like crap for a day. It just took a day and I'm good, you know? And then at least now you're protected as well.
Yeah, it is a double-edged sword. I know what you mean, Leon, when you said that if you start emphasizing it, then people will be like, well, I don't want to have that day of feeling bad. So some other questions here. And I thank you both so much for providing your insights and guidance. How long does the flu vaccine protect you?
So it's really just going to be for that flu season, which is why you have to get it every flu season, basically. Mm-hmm. So it's just going to be for a few months.
As some of my colleagues say that, you know, there is some degradation of its immune effect over the time. So you don't want to get it in July, given that flu season peaks probably in February. And that's
Yeah.
that decrease in being, protected probably is a bit faster in older folks.
But
So
you don't want to wait. You don't want to
you
wait.
don't want to
So
wait till it happens.
no. So when the flu vaccine is available, you definitely want to start that late August, that September when it's available, because some people want to wait until, December, thinking that, oh, I'll have a better immunity by January, February. But I mean, we've had some early flu seasons as well. So it's important to go ahead and get the vaccine early, and we still expect you to be protected in February.
Sounds like November is a great time to get a flu vaccine if you haven't
Right
gotten
now.
it already.
That's right
now.
now. November, better times in the present.
I
Maybe
got mine in August.
So do I.
I got mine in October, but it sounds like folks who haven't got it, maybe the day before Thanksgiving, the fam can all go and get their shot, or the day after, and you can enjoy all the food and football as well over the next weekend.
So
Here's
true.
a question. How do you recommend we government outreach workers, what do you recommend we government outreach workers do to help communities of color better be of service to them? So what can the government's workers do that would, kind of support and your efforts?
I guess government workers on what level?
I don't have any more information.
But
Government
I would say
outreach
in
workers.
general, just education. My big thing is just education and giving out the right information. So if the government is using outdated information or information that is from Facebook, no, you want to get it from a reputable scientific source and then outsource it to the population.
And tailor that information to the patient population that you want to reach. You're going to have to design it so that individual can understand it, that individual can relate to it. Blanketed information is not always the best method. You have to really make it, you have to make it about that patient and focus on that population that you want to effectively change.
So hyper local is what we're calling that. To really meet the needs of a group of people in a given community. So I'm going to ask this question, and you guys can pretend that you're the doctor answering this question of a patient. This comes from our audience. What is a positive response to a person who thinks they don't have to get the flu vaccine if they've received the COVID vaccine? Now, Leon, I know Dr. Conley-Harvey can knock this out of the park, so let's start with you.
So, I know my response is just the COVID and the flu are two different things. If you've had the flu, which I've had the flu before, I've had the flu and COVID. So I'm telling you both, as a person who's had both of them, you need to get vaccinated for, and I had the flu shot when I had the COVID. So obviously that does not protect you against COVID. So my thing is that I'll use my own personal experiences to advertise or to push that you need to get them both separately. They do two different things, and it's just important to make sure that you're protected on both ends.
All right, Dr. Jerrels. Perfect. Yeah. I mean, that's really the answer. Just that there are two different vaccines. They're protecting it against two different things. And if everyone gets the COVID vaccine, that'll be great. Numbers be low, but then the flu is going to come. And we're going to have this big outbreak that we don't want. So, that's why it's just important to get flu and COVID vaccinated so that we're protected against both.
I see we are here. We have Reverend Ratcliffe joining us at this point. So maybe we can invite him. Hello.
Hi.
Hello, hi. My name is Louis Good. I'm invited by
Louis.
Dr.
Thank
Yes, how you doing? I'm actually in Dubai, so I apologize if the reception is bad.
Well, we are so you are not Pastor Dr. Joe Samuel Ratcliffe. You are Louis Good, the owner of Good
Looks Barbershop.
So that's a part of the community leadership in flu vaccine promotion that we haven't heard from. So tell us about what you've done.
Okay, what I've done was I hooked up with Congresswoman Sheila Jackson Lee.
Mm-hmm.
Yes.
Well, I linked up with her and we did a drive in the shop for almost, I think it went 2 months. And so we had them come out and they did testing and we signed folks up to get vaccinations. It was due with Pfizer. And the mayor came out, was in the barber shop. All the barbers that we have are vaccinated. It's 7 of us. And we reached it out to the University of Houston and Texas Southern University in Houston, and they all came out. We might have did, at first it was kind of slow at first. We might have, the first day I think it was maybe 20, and then the ball started kind of rolling as they start coming in, repeated coverage, start seeing the stuff still there, and they start signing up.
What made you do this, Lewis? Why did you get involved in promoting COVID vaccination in your community?
Okay, basically, I'm a barber in Houston. I just feel I do a lot for the community as far as barbering. I think it's our duty to kind of reach out and help people. And we need to use our platform because we cut hair all day and we try to raise kids and also like raise college kids. So I just think as a parent, if I'm getting as a parent and my family's doing it, I feel my customers or my kids as well, or it could be my friends as well, or my elders. And I just feel it's very important that we all get vaccinated. And I just want to hold a platform. I just think the churches do a great job and the politicians do a great job. But I think the grassroots people like myself as a barber and beauticians, I just think that we during COVID, the churches were closed down. So I think we were the guaranteed link. And I'm thinking President Biden, when he came out and said he wanted to start using barbershops, I jumped right on it.
Huh. So what have you heard from your clients? You've had a range of responses?
Yes, everybody talks well, but what I've noticed, the young ones was kind of slow about getting it, but then I think when they start offering money, for some reason they start coming in like crazy, and then
Right.
I mean, I don't know why, but that money made them come in. And then I even thought one day to myself, I was slow in the barbershop one day, and I was already vaccinated, and I was like, well, hey, I want that money too. But I was already vaccinated, but I wanted my little lick. So but like now the new thing is booster. The booster thing is new now. I haven't received my booster personally. One of the other barbers got his, but I'm definitely working on that. I'm actually in Dubai now. When I get back from Dubai, I'm actually gonna get signed up for my booster.
That is
Sounds
so
good.
fantastic.
Yeah. But like I say, I just think that we need and I know I have a platform by being a barber, but I just think that everybody should be telling somebody, or I feel that neighborhoods should be reaching out as far as your own community. I mean, if you got a neighborhood, I know one time when I grew up, I was born in 1968, so we knew the whole block. But nowadays, these suburban areas, we don't really know our neighbors. So I just feel we should all come outside and just start talking about it within neighborhood versus waiting to the barbershop. That's fine, I'll receive it, but I just think we all need to kind of help out. I'm just thinking everybody, but I think the overall, I think we're all kind of getting a message, and even in Dubai, you can't even walk anywhere through the airport. I mean, you got to be masked up at all times. I'm in the room now. I just got it, but everybody's masked up.
Good.
And I'm just leaving Houston. It's kind of I think Governor Abbott. It was like it's not mandatory in Texas, but here it's mandatory. But
it's an interesting observation you make about how, we used to live in neighborhoods where you did know everybody in your neighborhood, basically. I guess our neighborhood is now our social media network, huh?
Exactly.
So do you use social media with your communication?
I do, and I really do, and that's a great platform as well. I got my barbershop is called Good Looks Barbershop, and on Instagram it's called Good Looks Barbershop as well. And we do a lot of. I'm 53, so I'm not that savvy, but I got a lot of young customers, and they help me out with a lot of that kind of stuff. But as far as the mask, we don't have. It's not mandatory in the barbershop, but we have a sign posted, and we have masks. University of Houston has this program called Healthy Start, and Healthy Start, they come to the barbershop and they bring masks once a every other week they bring a pack of the University of Houston autograph with the whole logo on it. So we stay masked up as far as like, you know, stuff that we need to give out to the customer.
That's fantastic.
But it's an organization called Healthy Start.
Well, so before I go ahead, Cherice, please.
Oh, no, I had nothing.
Oh, before I ask you all the last question, like what's coming up in Houston to get the flu vaccines going? Let me just share this one comment that people may not see. It's about in Seattle, Washington, where they combined a partnership in healthcare with the faith-based communities and Safeway pharmacies and the City of Seattle Fire Department. So they really work together to get the message out. And I just wanted to honor that offering in the chat box. But we're coming to a close, Tal. So I guess I would ask each of you to say something about what's unique or great about Houston and how you're going to marshal forward to protect as many of your members of your community against the flu.
Okay. You gonna start with me?
Yes, you go first, Louis.
Well, thank you. Hello, everyone. I apologize for coming on late. I apologize. But like I say, when I get back, I kind of been slacking as far as like, I'm gonna be honest. We kind of been, I kind of slacked off in the last month as far as bringing awareness to it. But I'm gonna make it my duty as soon as I get back to really push that booster, because I need to get the booster. I'm gonna really reach out to the mayor and the city councilmen to see if they can have someone do the boost at my shop. So I'm really gonna jump on it as soon as I get back. And as far as Houston, I think Mayor Sylvester Turner is doing a great job with it. So all the city council that's in the area is doing a great job as well. So I think Houston is kind of, I don't know what the percentage or what of who's been back there as far as, you know, the pros and cons on it, but I just feel for what I hear in the third ward community that everybody's pretty much been vaccinated, I think.
Thank you. Dr. Conley-Harvey, I know you have to leave sharply at 1. Last thoughts, offerings about Houston.
Well, basically just continue to, educate the masses. I know our marketing department oftentimes does programs and go to some of the employers that we work with to offer the flu vaccine. So just continue the same efforts.
Thank you. Leon, you get the last word. You're on mute.
So for Houston, I think the potential is great here. We have the largest medical center in the world here. We have a lot of human capital, a lot of information sources here. I think that Kelsey-Seybold is perfectly positioned and has the proper connections within the community, within the local government, to remain a good knowledge source. From my end, I know that we're going to do outreach in multiple different dimensions to make sure that we get out the information to all our patients the best we possibly can. I mean, it's the start of the true flu season, the peak of COVID. The world is just going to get busier and busier and busier, and we're going to do our job.
Oh, that's fantastic. Well, I just have one last note. I want to say happy Thanksgiving. And thank you to our panel. You guys were great. And thanks for your wonderful work. Thanks for everyone on the call as well. Take good care.
Thank you. Be safe.
Thank y'all. Everything's